How did you get into the world of stem cell?
Well, I think the backbone of what I was doing with my career was always medicine and focused on stem cells and regenerative medicine. But I have actually baseball to thank for a lot of reasons of why I got so into regenerative medicine.
It was an injury, right?
Yeah, I was playing baseball at the University of Michigan while doing my pre-medical work, and I did a master's there in molecular cell biology, and was going to head off to medical school.
Right.
I had applied, got accepted, and I had the unique opportunity as well to get offered a professional baseball contract. So I very quickly tried to explore if I could continue my education at the same time.
Yeah.
Even talked to the dean to see if I could actually do the MD at the same time. Of course, as you would know, going through it, that's kind of impossible. But that being said, I was able to do a PhD. There was the flexibility in the program to do that, and so I did a PhD in biomedical engineering and specialized in tissue engineering and regenerative medicine.
Here's a question my patients ask me all the time. Okay, so Dr. Chin, you want me to pluck my hair, freeze my follicle, because in it is stem cells. Why should I do it? You have said in the past that there are like 3 types of patients that would benefit from this whole stem cell technology. Can you tell me your 3 areas?
In general, I think anybody can benefit from having access to their younger selves, right? So every day that goes by, our cells are getting worse, and unfortunately that leads to the accumulation of inability for our cells to perform and age-related diseases. That being said, when I was working in developing regenerative medicine solutions in orthopedics and sports medicine, what we learned was that the age of the patient is the biggest limiting factor in being able to leverage their cells to create tissues. And so when we think about the future and this amazing space in regenerative medicine that is in aesthetic medicine, sports medicine, and beyond, right? In treating a number of different age-related diseases, our limit in our potential to help that patient is going to be how old that patient is. And that's because we're leveraging that patient's own cells.
Right.
So instead of a drug and we're manufacturing in a lab and worried about purity, we're now taking some of your cells and putting them in a place where they can derive benefit and replace that deficiency that's going on. So the power of that starting material is how good of cells do we have access to. So anybody that is freezing a younger source, right, a more vibrant, vital source of their cells to leverage in the future as problems arise is going to have a better starting material.
So the first place that I'm going to get involved with you is what you would term rejuvenation, right? Code word, anti-aging, aesthetically. Would that be a fair statement?
Yeah, I mean, I think in aesthetics we think about kind of 2 major areas. One, first of all, the skin is the largest organ in our body, right? Yeah, it's skin and hair, right? The skin is our largest organ in the body. We're going straight to the source. What we take is hair follicles. So those cells have mesenchymal stem cells, the same type of cell that's in our bone marrow. Fibroblasts, the deeper layers of our skin. The keratinocytes, the upper layers of our skin. And all of those really allow us to capture cells from that patient that we can directly influence the skin with. The cells that are producing growth factors, they're producing exosomes to communicate. The matrix molecules, collagen is the most prominent, protein in our bodies. So obviously producing those things declines with age.
Right.
And if we can reintroduce better cells, better populations
You manufacture it outside my body?
Yep.